So we started off this evening by hearing in many different ways about some of the new approaches to treating cancer. And is there anyone who has a question that they'd like to start off with? Okay, so over here. So if you've got a question, I'll come around and you can speak into the microphone so that everyone has a chance to hear.
My question is just, obviously there's a lot of different treatment options available for different kinds of cancers, and some of them are by people that perhaps don't know what they're talking about. And the internet, of course, proliferates all kinds of information. I'm just wondering if you're seeing that becoming a problem, people taking their treatment into their own hands and going to treatments that are just not effective, and how much is that happening?
So this is a very interesting question, and I can tell you that 10 years ago, I would have patients coming to my clinic with sheets of paper that they printed off from the internet, you know, great wads of paper and so on, and looking confused, not surprisingly. And what I can tell you is that has changed quite a bit. There's an appreciation that it's not that simple, that the individual that they're seeing is supposed to be an expert and can navigate through that process. So I find that it's now normalized. There's a balance. There's no question that people still raise issues, and particularly may identify clinical trials that may or may not be possible. But there's been a tremendous shift in cancer treatment. I used to spend quite a lot of my time asking patients to reconsider the possibility of going to Tijuana, quite apart from the fact it's a dangerous place, but going to Tijuana to go to a cancer clinic for unproven therapy. That happens very rarely now. What's happening now, and it's recapitulating the whole cancer treatment issue, is that we're getting what we call stem cell tourism, where people are desperate to get cell therapy that is not proven or ineffective in places where it's not controlled or it's not documented. Places like Mexico, Thailand, other places. The reason that there's been this change is because the medical establishment has taken some of these alternative treatments seriously and investigated them. And for example, there was a study done comparing Laetrile with standard of care. And it became very clear with that comparative study that Laetrile was not effective, and that sort of settled that issue. But I'd be interested in hearing the comments of my colleagues about this issue.
Well, I think that's a very insightful question in this day and age, because in every field, no matter what field you're in, there's an information overload with everything. So particularly for my field, I kind of agree with what Steve had mentioned earlier, that I actually tell my patients not to surf the web and not to go and look up their particular child's tumor, because I really worry that they go and find cases where either the outcome is so dismal or so poor, or some miraculous save or something that just doesn't apply to their child's particular tumor at all. And I mean, in this day and age, we're trying so much to really not only to find selective therapies for a certain population of cells that we think may generate the tumor, but we're also we're realizing more and more now that every tumor is different and every patient is different. Because it's not just a bad cell that goes wrong that proliferates. It's proliferating within a niche. And so there's a very sort of popular concept also that comes along with the cancer stem cell hypothesis, which is that the stem cell lives in a niche. The normal stem cell lives in a normal niche. And the abnormal stem cell may have been generated by an abnormal niche. So I guess what we're saying is, just like a lot of things in hematology that Armand was discussing, everything, there's a host and a tumor. And there's interactions between the host and the tumor that may actually dictate what the tumor does. And then on top of that, there's immune surveillance. So it may be that the very same tumor cells that are circulating in my body could be killed by immune surveillance, but escape immune surveillance in somebody else. So there's so many factors, both about the host and the tumor, that are individualized to every patient. It's almost impossible to find any other cancer case that is exactly the same as yours. And so as a result of that, we try to direct therapy with our best possible knowledge, like the most current knowledge, the best possible therapies. We study the patient's tumor in every way, shape, and form, everything we can get about it. We study everything. We study the MRIs, we study the blood work, we study the lab tests, we study every piece of information. And thankfully, for those of us who are scientists, we can go to the lab and study the tumor too, and then bring that information back to the clinical interpretation of things. And we try to put together this big picture that belongs only to that one patient. And then we say, okay, now how do we get this tumor in this patient? And I think it's becoming like that. I don't know if I'm speaking for everyone, but I think it is becoming more and more like that in every field of cancer now. And so that's why I caution people, don't go to the web. You won't find your tumor.
One specifically related to that idea is the fact that there's a lot of what's called molecular signature profiling, meaning you can send your tumor to the lab and find out what genes are abnormal. But there's patterns that we see within the same tumor system. Colon cancer generally have the same genes that are mutated, but the nature of the mutations could be slightly different. So we are trying to break up the big pie into multiple pieces and see if there really are patterns. And those patterns are predictive of what drugs people will respond to or fail. That's kind of the future. And even yesterday, I think in New England Journal, there was I don't even know this tumor, it's a rare tumor, but there was a small fraction of this rare tumor, so rare and rare, and that little fraction responds to a drug that was targeted to that abnormality in that particular tumor. And it was a big home run story because these few patients with these tumors could be cured before they wouldn't have, based on this molecular story. And this is what you're going to hear about a lot. The drug companies have a real challenge because now you can't hit every nail with the big hammer that you have. And one drug isn't going to work for 500,000 people, and they only work for 1,000 now. So this is one of the challenges for the pharmaceutical industry. The other question that I think you may have been addressing that I'm particularly interested in is kind of the socialization of patients and medicine is changing a lot since I started a long time ago, where it was more of a paternalistic approach. The doctor said something and the patient listened. And your parents probably were like that. I see many people are actually quite young, and so it's a generational difference. I think, and I have kids your age or a little younger than you, and I think that there's this phrase now called the activated patient. And these are people that literally know a lot. They know a lot what they read, and they've read on top of that, and they are developing a bit of an expertise in their own cancer that's pretty sophisticated. It's not as sophisticated necessarily as the specialists they're seeing, but it's pretty sophisticated. And some doctors get their backs up and aren't unfolding stories, and I've had those stories too, and some people just accept the fact that this is the way society is changing. So I think, medicine's not static because patients aren't static either. So I think that's what you're getting at, and we have to adapt to that, and sometimes it's a challenge.
So do you agree or disagree with patients checking the internet, or would you like patients to just get information from you?
I don't think I can't say agree or disagree. I think it does depend on the approach. If you have pancreas cancer and you go to the Pancreas Cancer Canada website, you'll learn a lot, and that's useful information because we don't have time. We just don't have time to provide that much information as much as we'd like to. So I think it does depend on the quality of the information and why you're doing it. On the other hand, there's probably a lot of harmful and dangerous, misleading information on the internet. So there's no simple answer to that. I don't think. It's a bit of a cop-out, but I don't think there's an answer.
And I think maybe a good suggestion would be that you and your doctor should collaborate on what information applies to you or your child, right? So I guess when I said up front, I tell my patients not to go to the web. I guess I mean don't go to the web before we find out more information about your particular tumor. And then once we do, there's lots of valid websites out there that would apply or pertain to your particular situation. I guess what I'm saying is maybe don't bother looking at the ones that don't. So I guess it should be a relationship between you and your doctor to be able to guide which sites are going to be reliable for you.
Yes, I would just emphasize that point. I think Sheila's making an excellent point about that issue and the approach that I take, and I think many of my colleagues take in medical oncology, is to do this in a collaborative fashion. Once all the information is in, it may be that there are some options that are available, and some of those options may relate to quality of life issues. They may relate to risk up front versus cure down the end or at the end or whatever, and that, I think, is a terribly important issue to discuss with the patient rather than being prescriptive.
Quick question, what would you like to? Do you actually take the time to...
Just so everyone can hear. Do you actually take the time to recommend good websites to your patients, or do you?
So the answer is it depends. There may be good websites for particular diseases. So if you take chronic myeloid leukemia, there are actually good websites there. The Leukemia and Lymphoma Society has an excellent website on a number of blood cancers, and I suggest that they look at that because it's a little more directed. It doesn't address the really important issue that Steve has raised and that Sheila alluded to, and that is it's very difficult to get specific information about that patient's particular condition. But under some circumstances, it may be quite appropriate to get a general overview. And to do that, it's absolutely essential to have reliable information. Now, my colleagues and I try to provide that as much as we can. We have pamphlets and again, distributed by various not-for-profit disease-focused societies. So I think that seems to be working, and in fact I've had patients come back with the booklet with information to ask specific questions about the particular issue as it pertains to them. That's very useful, and it just improves their understanding and the limitations or the potential of whatever the therapies that we're recommending.
Yeah, I have another question over here.